Good afternoon. Good afternoon, everyone, and welcome to today's panel discussion on the global political determinants of health. A little over 5 years ago, the Lancet-University of Oslo Commission on Global Governance for Health was published. And its report, The Political Origins of Health Inequity, asked about the prospects for change. The Commission showed that health inequities within and between countries cannot be addressed only through healthcare or domestic policies. Norms, policies, and practices across nations involving diverse actors should be recognized as political determinants that cause and maintain health inequities globally. My name is Katarina Storeng, and I'm Associate Professor at the Center for Development and the Environment at the University of Oslo. And I'm also Deputy Director of the independent expert panel that was set up on the Commission's recommendation. And during the past 5 years, the panel has been producing research, organizing conferences, and trying to raise awareness about the transnational or global political determinants of health. And we are very delighted to be hosting today's panel discussion as part of the 6th Global Symposium on Health Systems Research, which focuses, of course, on the theme, how we can build health systems which improve people's health and are socially just. Now, although this conference and this session was planned over a year ago, it's a particularly timely moment now to take stock of the enormous global transformations that are going on and the impact on health and health equity that have happened since the Commission's report in 2014, especially given this extraordinary year that we've just lived through and the uncertainty about the future of global health. Looking to this future, we want to ask in this session, what are the most important transnational political determinants of health equity as we enter the final decade of the SDG era? How can we and the broader health systems and policy research community especially engage with these determinants to improve health equity globally? So to answer these really important questions, we've organized a moderated roundtable discussion with some of our most prominent thinkers on the politics of global health. And I'm delighted to introduce them. First, Fadi El-Jardali is Associate Professor of Health Policy and Systems at the American University of Beirut and Director of the WHO Collaborating Center for Evidence-Informed Policy and Practice, and has played an important role in the organizing committee for this conference. Professor El-Jardali is a senior expert in health policy and systems with senior management and policy experience from both the public and the private sector, including as founder and director of the Knowledge Topology or the K2P Center. Second, we're delighted to have with us Kelly Lee, who is Canada Research Chair in Global Health Governance at Simon Fraser University in Canada. Professor Lee is an expert in international political economy, public administration, and international organization. And her research interests include the impacts of globalization on population growth, the commercial determinants of health, and the implications for collective action. And Kelly currently leads the Pandemics and Borders project, which analyzes cross-border measures during COVID-19, highly relevant to today's theme. Our final panelist is Oren Levine, who is Director of Vaccine Delivery in the Global Development Division at the Bill and Melinda Gates Foundation. Professor Levine is an expert in the field of international public health, immunization, and child survival, and has a focus on promoting more equitable health outcomes globally. He also sits on the governing board of Gavi, the Vaccine Alliance. Asha George, who is Chair of Health Systems Global, sends her apologies. She was supposed to join us from Cape Town today, but has been prevented from doing so. But finally, I'm delighted to introduce my colleague, Sridhar Venkatakuram, who will moderate the discussion. Sridhar is Associate Professor at King's College London and has an interest in the philosophy and ethics of health, health inequalities, and global health policy internationally. And he's been part of the independent panel that has been following up on the Lancet-University of Oslo Commission's work since it started, and is therefore very well placed to take stock of these global political determinants of health and equity. And before I hand over to him, I want to encourage all of you to submit your questions to the panel using the live Q&A function on the conference portal, or if you're joining us through the direct Zoom link, the Q&A function on Zoom. This session is being recorded and it's going to be available to registered participants who can watch it on demand via the virtual health systems conference platform, and also to anyone who's interested on our website soon. So I'm now going to hand over to Sridhar to lead us through the discussion, and I'd like to thank you all for attending.
Thank you, Katrini, and welcome to all of you to this afternoon's session. And I'm really thrilled about this particular conference theme and also about this session. One of my great passions is this concept of social justice and how do we bring social justice into health and what are the different kinds of dimensions of it. And so it's an extraordinary opportunity for us to take stock about 5 years after the initial University of Oslo Lancet Commission on Global Governance for Health and what that has meant for social and global justice within countries as well as across countries. So what we have today is a really nice long piece of time that we can take our take our time to think about these things. And unfortunately, that some people can't join us today, which means that there's more time for people to be able to say what they really want to say and take their time to do it. So the way that we are going to do this panel session today is that we've given each of our speakers an opportunity in the beginning to set what's on their mind about this topic. And then we will do a moderated discussion in order to make sure that we cover some of the main issues that arise from that commission's work and what the implications are. And then we open up to the general discussion. So as Katrini said, we really encourage you to not only reflect as the conversation is happening, but also to highlight the questions. I hope that there are many of you from the conference, and I hope that there are also many of you that are joining us directly into this session and into this Zoom. And so you also have the opportunity to ask your questions as well. So in hopefully alphabetical order is a fair way to do the order of speakers. I always lose out in this because I have a last name that always is the last, but that sometimes can be good. But so we are going to, so the order that I have is Professor El Jardali, then Professor Lee, and then Dr. Levine. If that is okay with all of you, yeah? So then what I would ask is that I'm going to generally keeping watch on time. So unless you go egregiously over, so I think a 5-minute sort of opportunity for you to ask and answer the question. What we had suggested is, what's your understanding of the most important political determinants of health inequity at present? And so please, so for the first speaker, it's Professor El Jardali.
Thank you so much, Sridhar. Thank you, Katrini, for the introduction. So let me just put a few of the thoughts I have particularly on this topic. So we're going back to the SDG agenda, and we're really within 10 years away. I believe that still our health systems around the world are far from achieving equity and social justice. And I think this is also one of the reasons that we have this theme for HSR 2020. So we have people living longer, we have non-communicable diseases, we have new threats, we have issues about environmental degradation, climate change, and also urbanization challenges. So certainly the achieving the target when it comes to SDGs is really a major challenge. This from the context of the Eastern Mediterranean region. So this is the region where I come from. Now, if we look at the EMR region, we have seen really substantial improvement over the last few years when it comes to improvement in health indicators, such as life expectancy, maternal mortality, child mortality. But still, there is a lot of disparities, inequities when it comes to health outcomes. Now, to go into how we define that when it comes to inequity. So, as you know, the Eastern Mediterranean region hosts the most serious emergencies and crises worldwide, I would say. And we bear the largest number of displaced population globally. So out of almost 68 million refugees internally and internally displaced population, more than 57% of those come from the region. So this is really, when I talk about determinants, we're talking about certainly war, we're talking about peace. Of course, non-communicable diseases and injuries still a major burden. But when it comes to how much where the total expenditure on health per capita, we're still really, the whole region is still falling short of the global average. And the out-of-pocket expenditure still, unfortunately, exceed this threshold. So we should not accept the argument that one can turn into a poverty just because they are not really able or afford to access high quality care. So this being said, in our region still there's around 41% of the total population are classified as poor, and many of them are really vulnerable to poverty. I want to talk about also the food insecurity, which is really a major issue in countries like Yemen, like Iraq, like Sudan. So we have undernutrition, malnutrition. Certainly Yemen, Syria, and Iraq are identified by the World Food Program as a major food crisis. So what that means is that we are also vulnerable to food security or insecurity. So now, why I'm saying that? Because in our region, we are really more of a large food importers, and this is where we're going to be talking later on about some of the determinants. So, if we want to talk about the political determinants of health inequity, we need to really think about that many governments still are adopting a technical biomedical approach to improving health outcomes. So this is really, and this is creating inequities. We're talking really about, we know now even from the COVID-19 that many of the determinants of health is really beyond the control of a single government or a single nation. There is also the issues related to the as I mentioned, to the food security issue. So this is really more about, we know that the global level factors that have an influence on food security, including agricultural trade agreement, price volatility, replacement of domestic food crops with export crops, etc. So these are also put a lot of challenges on vulnerable population. Migration, as I mentioned, and certainly the COVID-19 crisis showed that, in fact, migrant workers, refugees, etc., they are not really part of the existing health system arrangement. They are not integrated within the health system arrangement, and they are really subject to poor socioeconomic status and vulnerability and violence and exploitation. I mentioned before about war and peace, so this is really a major issue, and we've seen it in countries like Syria, Iraq, Afghanistan, and others. But let me say something. Over the last few decades, many countries globally, they invested a lot and put a lot of investment to protect themselves from attacks, from terrorist attacks. But there hasn't been a lot of investment in public health infrastructure to protect from attacks from viruses, which does, in fact, they are, as we know, viruses are, pandemics are blind to national boundaries, and this is something that is really very critical. Certainly, the global integration of financial market, it put also some challenges on low middle income countries when it comes to how much they are spending on health, a trade and investment agreement, and we've seen it how it impacts pharmaceutical policy. Now the discussion about the vaccine for COVID-19, and we should not accept or even let it go the argument that there are some technical challenges that some low and middle income countries or poor countries will not be able to have immediate access to the vaccine. We should not accept this argument. And this is really goes back about all the investments agreement and trade agreement that was really done, and the power asymmetry, and certainly many of the corporate, and this is really about the corporate actors and sectors and how they are really impacting global health governance. And we're seeing it a lot. For example, let me give you an example. Smoking rates are falling in high income countries in response to a lot of good tobacco control policies. But guess what? Many of the global tobacco industry now are seeking new customers and shifting their marketing efforts, unethical one to some extent, to low and middle income countries. We're still seeing really a large number of smokers. So the issue about the role of the private sector and corporation and how much they exert power and influence our health is very critical. And I think we need to really look at it from large corporation, pharmaceutical, food, tobacco, technological industry. All this has really a major impact on our health. And I want to mention that there is certainly power asymmetries between countries. and we're talking about donors and recipients. And we've seen it even in my region, in many of the countries I've actually worked and interacted with. Sometimes the recipients are really entirely dependent on the goodwill of the donors, either agencies or government, but many of them, they have their own interest and motivation. And sometimes the investment, unfortunately, doesn't go where it should go. So the last point I want to mention, that we need to also think about, and this was discussed earlier also in a symposium, about the issue about corruption and the lack of accountability and the lack of transparency and limited stewardship of government. This is also related to some of the determinants, political determinants of inequity. So I'll leave it at there, Sridhar, and I'm happy to actually delve more into some of the details later on. Over.
Fantastic. Thank you very much for that really quite a long list of determinants that, or political determinants as we're calling them. So just let's move on then to Professor Lee next.
Thank you so much. That was a great start and really set the scene. And given how all of our lives have pivoted sharply towards COVID-19, and it's really difficult to think of nothing else, but I want to thank you both, Katerini and Sridhar, for just organizing this panel, reminding us to put this pandemic in a broader context, and particularly in the context of global health and development. That's where it really should be understood. So I think we can only make sense of what's going on in terms of this pandemic, in terms of health inequities, really. So this is a really good panel and good timing. So on your specific questions that you've posed to us, I think there's a lot here that really needs unpacking. But very briefly, on the most important transnational political determinants of health inequity, there's a lot in that phrase. For me, this is unavoidably, I think, about how we have constructed our globalized world in ways that prioritize generating wealth and earning profits above all else. We've put everything else aside in many ways. So economic globalization since the late 20th century has been really driven and defined above all by this specific market ideology, which has led to certain types of actors and interests to emerge and become very powerful, more powerful economically and politically than any others, which has led to the adoption of certain institutional arrangements that enable these actors to concentrate power in fewer hands and to exercise that power transnationally, and has led to these to a widening really of these health inequities and other types of inequities as well, which we're seeing playing out in this pandemic. So this, of course, is not news, and we've just heard of some of these inequities and some of these problems, and these trends have really been flagged for a number of decades. So I'm not saying anything that's probably very new to everyone, but I would add to this conversation the importance of extending the concept of the commercial determinants of health, which is increasingly used in the public health community. We can use this concept to really interrogate what I've just described, these much broader trends. So for me, the commercial determinants of health span a broader range of political and economic actors than I think tend to be studied under this concept in public health. So definitely we need to look at the industries that create, health harming products like big tobacco, big alcohol, and ultra-processed food and so on, which has been the focus of this research so far. But I think we also have to consider how other transnational corporations operate in ways that contribute to health inequities. And these include extractive industries, the manufacturers of products which, by the way they're produced, are harmful to human health or planetary health, fast fashion, I'll add in electronics, big food, big pharma, anything that's manufactures that's disposable. All of these kinds of things, the way that those products are produced is problematic for health and the environment. And beyond these actors, we have other actors that actually sustain this whole enterprise. So chambers of commerce, industry associations, commercial banks, and I would add in ministries of trade and finance and regulatory bodies. So all of this is embedded within globalized supply chains, trade and investment agreements, financial systems, and regulatory frameworks or lack of regulatory frameworks. So that's how I would define commercial determinants of health. It's a broader conceptualization, but I think it's very relevant to how we discuss this particular topic. And given this diagnosis, I think in this broad sense, how can we then engage? Because it's a huge task, as I've described. How do we improve health equity within that framework? And many have warned about the social consequences of market-driven economic globalization for many decades. So it's been a challenge that has not been has been met yet, as we know. So what difference is it that this pandemic particularly makes to this effort? And I would say that the difference now, we have a real opportunity with the SDG period remaining, is that there's been consequences for those who have been driving this globalization bandwagon. And, you know, ostensibly this pandemic has been caused by a novel coronavirus, we know that, but how the pandemic has played out and how it has spread so quickly, how many governments found themselves scrambling, unprepared, and how WHO was found to be under-resourced, and how people have just been impacted so differentially across the world, has not been about the virus, it's about politics. And so we have to think about how we have configured the world in a way that has made us all vulnerable. And this includes shutting down the entire world economy and the huge amounts of lost revenues that has hit the wallets of transnational corporations and ministries of finance and trade and other key actors that have underpinned this world economy. So there's a real opportunity here to connect the dots between how we have restructured the world to generate wealth above everything else, to minimize tax, to undermine the state, and to disregard human and environmental costs, and this pandemic. So, you know, we need to make that connection. And so finally, I would conclude my opening remarks, if I have just another minute, by saying that the way we have constructed this globalized world since the late 20th century is not simply the result of an invisible hand of the market. So I think that we often hear, you know, these economic rationales, efficiency, productivity, return on investment. You know, we have to remind ourselves that this world order elevates particular ways of seeing the world, particular values, particular ideological beliefs. And so economic globalization, as we've seen it unfold, in short, has resulted from deeply political choices. So I think this gives us hope, because I think we can make different choices and we can elevate different ways of seeing the world and give higher value to things like equity and sustainability. Thank you.
Excellent. Thank you so much. I'm going to try very, very hard to resist any commentary and just move on to the next speaker. So Dr. Levine, your 5 minutes.
Thank you. And thank you for the opportunity to talk with you all today. I'm never quite sure how to address everybody. It's morning here, but I know it's afternoon and maybe even nighttime in other places. And it is hard to resist. We've had two really great and provocative opening speakers and comments. So I think what I'll do is stick to a few of the, I guess, observations that I have, and hopefully then we'll have that rich discussion to follow. When I think about the transnational determinants, I start by thinking about kind of what kind of world are we living in. And for me, I think we are living in this VUCA world that people are talking about, you know, volatile, uncertain, complex, and ambiguous. And unless we acknowledge that, I think we're missing an important reality of what's at play, and one that impacts how we respond. As I thought about comments for this morning too, I also thought about it's the wrong word, but the opportunity that COVID provides us to have laid bare or exposed some of the consequences and implications of what we're facing right now. I would look at three important, I would say, consequences of COVID that have implications for transnational determinants. One is about markets. Early on, we had very unequal access to the commodities that countries needed to respond. We had it transnationally. We even had it subnationally. It was not access to things like PPE, personal protective equipment, diagnostics, et cetera, were not allocated in any way that was equitable. It was a mad dash for what can I get my hands on, because I either manufacture it within my home country, or I have the economic power to sort of draw it away from other countries and secure it for myself. And that's had consequences. One of those consequences, which we'll talk about in a minute, is on trust. The second observation is that the impact of COVID has been disproportional, and it has disproportionately affected communities of color, communities that are impoverished, communities where the requirement for livelihood did not lend itself to safe kind of conduct of that work in the context of the pandemic. And then the last is, and I may be particularly sensitive to it by virtue of the country in which I live, but science has been highly politicized, with trust in science again at a sort of low point, I think, compared to before the COVID response. It's almost been politicized to the degree to which it's become sort of a loyalty test about whether you're willing to accept certain statements. I think those three consequences of COVID are underlined by some significant determinants or features of the way that we are acting across the globe that need to be addressed. And I think that there are some opportunities, hopefully, in those. One is, I think we have to talk about trust. I think trust both at the community level, at the national level, and then also at the transnational level. And I think tied in with trust are power dynamics. The moment that we have right now, by virtue of a whole host of different factors, in the country in which I live, the demands for racial justice have never been higher. They're also, I think, reflected in different ways in conversations at a national level in other countries and in a transnational way, born out of the kind of egregious inequities that have been exposed both in ability to obtain commodities people need for the response and the differential impact of the COVID pandemic on different communities. And I think you see the power dynamics right now being expressed in different ways. Perhaps the way that I see it most significantly is just an adamant demand, nothing more about us without us, a insistence, to quote the musical Hamilton, to be in the room where it happens. There's a fundamental shift that I think is coming right now about how decisions are made, who's in the room, and how that power dynamic is shaped, that I think is really afoot. And lastly, I think what that will bring us to is a dialogue around multilateralism. It may also bring us to other manifestations of that some of the previous speakers have talked about, whether in the private sector or elsewhere. But I think for sure around the ways in which multilateral actors are organized and how they define success, whether it's just by the outcomes or by the process as well as the outcomes. I think those things are all wrapped up together. Those comments all sound kind of bleak, a VUCA world and COVID exposing things. I don't want to leave everybody with the anticipation that it's all bleak. I do think it's changing, and there's quite a lot at work that we need to take account of. But I do think there's some opportunities. I think one of them is encompassed in vaccination against COVID. There is a global effort at work right now. Part of the ACT Accelerator is focused on vaccines. It's called COVAX. And it is the multilateral, the global response trying to balance a lot of bilateral, vaccine nationalism that's already out there. By pooling resources and to procure vaccines and pooling the doses of vaccine secured through that in order to help to kind of equitably allocate doses to countries around the world, not strictly by the lottery of which country happens to have more wealth, but actually through an ethical and equitably justified rollout. For example, making sure that all healthcare workers in the world are vaccinated before you get into the 50 and 60% of a wealthier country vaccinating its population, and other countries have just not had any access to the vaccine. I think that response and that use of COVID vaccines as a instrument for addressing this is not just summarized, though, in how we work the market and multilateral dynamics. It's also fundamentally about trust. And I think we have an opportunity to build trust or to burn it in how we go about doing this. And if we engage communities, if we listen to them and communicate with them on how the vaccines have been tested, how they've been how their community's needs have been heard and incorporated into the allocation process, and take the time to do that, I think we have an opportunity to potentially build some trust, and in the process, build up the immunity that allows us to get back to a world where it's safer to interact with one another. I know from my standpoint, I haven't seen my parents in a year. I'm looking forward to being able to hug my mom and dad once we get back to a safer, better protected planet. So those are just a few of the thoughts that I had about transnational determinants. Thanks.
Thank you so much, Dr. Levine, and thank you to all the three speakers. It was hard to keep quiet from responding, just because I think it's very clear now as to why we asked you people, each individually and together, to speak, and some other people to speak, is that you have a very particular expertise and a view on how to think about these different kinds of issues that we're facing. But I just wanted to also sort of carry from Professor Lee's point, which is that this session, we didn't turn it into a pandemic session. We wanted it to carry on to the conversation about the Commission's work on global governance and the political determinants of health across countries and regions. So, rather than restate what the three of you said, I'm going to come back to what each of you said, and I can assure you I'm going to poke you in what each of you have said and to see whether you really mean what you just said. But the thing that I want to focus on is that I'd like for us to panel, and I think Katrina and I both want, is a focus on the global dimensions. So sometimes when we discuss things, we move within countries and across countries. And I just like to start with a global focus first. And it starts with this one observation, is that there were a few weeks earlier this spring that I was actually questioning the viability of certain international organizations and whether they would survive. And I was concerned that there might be one or two organizations that would no longer exist or make it, and it would be a domino that we would be looking at. But what's interesting is that everybody has survived. All the institutions have survived. And so the question, and some institutions have effectively repositioned themselves, right? So they've actually repositioned not only themselves in the pandemic, but they've taken a look at the politics that are happening in different countries and have started to reposition themselves in different political decisions and stuff. So the global order is going to survive, as far as I understand it. There's nothing dramatic that's going to change in the next year. So I guess, could you tell us, what do you think? Do you think that's right? Is that basically whatever the order was that was sort of 8 months ago or 9 months ago is actually intact and will continue? Or is there fundamentally, you think that there is there is potentially a crisis or an opportunity in which the world order is going to change as a result of these last 7 months? Shall we start with the same order? If you could just sort of say, 1 minute, 2 minutes, or something like that. So, Professor Al-Jardali.
Thank you. Thank you so much. This is quite insightful. Now, let me start by what you mentioned, Sridhar, that when you mentioned that it looks like the global order will survive, and I tell you that I would really worry if the current global order will survive as a result of what we have seen. And the reason why I'm saying that, because we have seen a lot of political rhetoric, I would say, at the global level over the last many months or so. We have seen less cooperation and solidarity, and the word solidarity has been being used all over the place. But I think one of the, and this may be linked to what Kelly mentioned, Oren, that we are at a time now, we need to rethink, reconfigure, redefine what global health is all about. We need to reconfigure, reimagine, redesign, redefine what multilateralism is all about. I think those areas are really need to be re-looked again very carefully. I'm hearing a lot of discussion about, yes, we have an opportunity. My worry that we might have a missed opportunity if the current global order will continue. We've seen, and I'm not going to talk about specific global institutions, but I tell you that there has been really also a failure in many of the global institutions of how they have handled the global health crisis. There has been an issue with in fact, we don't have an independent monitoring institution to address health inequity. And the COVID-19 aside, but we really don't have, in fact, a monitoring body that actually look at health inequities, that can hold global partners accountable. So we really have a problem with weak accountability even at the transnational level. We don't have sanctions, in fact, for actors who violate certain standards or commitments or decisions. So in fact, the global governance for health, and this is also the Commission mentioned about, and it mentioned that it should be rooted in commitment to global solidarity and shared responsibility, and looking at health as an outcome rather than a series of decisions or processes or some productivity factor or an indicator. So what that means, we need to really rethink about those elements. We need to really better think about the long-term level development. My worry now that still many countries think, okay, we can overcome this by investing more in health. Well, I tell you, it will be a big mistake to only invest in the health sector now, post-pandemic, because this is very clearly, we've seen it. There is no health security without social security. We've seen it how different sectors come to play. We've seen also some dysfunctions and failures from the private sector and the corporate sector in terms of dealing with that. Yes, we have an opportunity, but we need to have a mechanism to make this opportunity a reality. And this is what I'm not seeing this at this stage. And actually, personally, I'm worried that we might have a missed opportunity if we continue with the current, with the way we are doing things. If we continue with as you mentioned, the current global order of how we were running public health globally. Over.
Thank you, Professor Lee.
I couldn't agree more. And I think for me, what the pandemic has revealed is that there's so many imbalances in the current world order that need correcting, and they need correcting urgently. There's so many valuable lessons that we could take away from this pandemic that provide us with a roadmap for building a world order that serves more people in better ways. I think the pandemic has shown us that we've been living on borrowed time in many ways. The world order is really a world disorder. And these gaps between rich and poor have got steadily wider. We have that evidence. We know that's happened. The pace at which we're degrading our planet is faster and faster, and maybe possibly irrevocable. So we're at a tipping point, I think, really. This pandemic shows us that we're at a tipping point, and we need to turn this sharply around. So I think the pandemic has shown us that also with hope, we can do many things when all of our minds are focused at the same time on the same thing. And it has been quite remarkable what has been achieved during this pandemic in terms of multilateral cooperation. Yes, the Trump administration put WHO on the firing line and tried to derail its role in global governance. This was dismaying. I could only shake my head at what was happening, and I was also very concerned, like you, Sridhar. But what we've seen, though, I think, since over the past few months has given me heart. So other governments have stepped up, Germany, France, UK, but also many other countries have come forward to show leadership and to uphold the idea of multilateral cooperation and to plug those gaps in resources that we thought we would need to deal with, and to really put forward the idea that we need to strengthen and not blow up WHO. I think we've navigated through that now with the election in the US, but that I guess doubt around multilateralism in the US has not gone away. So we still have to deal with that. So my view, I think the post-pandemic world order should be one that recognizes that we can't really go back to business as usual. And I think, business as usual is what got us into this mess in the first place. We need a world order that prioritizes different things, not just this generation of wealth, which I described in my previous comments. And we need a world order that better balances collective needs with individual wants. A world order that thinks beyond Western democratic electoral cycles to one where we're sustaining life on this planet over generations, not over 4 or 5 years electoral cycles. I really believe we've been given this urgent warning about this from this pandemic, and I think we have an opportunity to really pull our socks up. Thanks.
Thank you. Dr. Levine, what does the world order look like from your perspective?
Sridhar, I wanted to answer your question with a question, which is you were a little bit ambiguous in your comment. Which institutions were you surprised survived?
Well, surely the World Health Organization was one, because basically, when you cut a significant part of its budget, it has to let people go immediately, right? There's no future, you can't live on borrowings at the WHO and stuff. So if there was a significant, if there was a domino effect where other countries started to pull out, then there was a possibility that you had a, and it's not, should be surprising, is that there have been people who are planning an alternative organization in a good way and in a bad way, right? So the people are like, what would an ideal health organization look like? So there were already plans on the table about what another organization might look like. So that's also possible. So, but please continue.
Yeah, thanks. Because I actually think, I think the disruptions to the world order may be more significant than they appear by virtue of the simple fact of whether a vaccine, whether an institution maintains its existence. I think some of the order that we've talked about is just still being shaken to the core. There are a few questions in chat around how national manufacturing and vaccine manufacturing in particular of different countries might become essentially a tool for foreign policy. And I think we're seeing that now, and we'll continue to see it. I think you will see a major push going forward by countries on many levels to reject the notion that the efficient global supply chain, largely Western manufactured, that then gets distributed somewhere else, is going to save them. They're going to want their own manufacturing of different key resources and commodities, and that's going to shake some of what has been a increasingly comfortable approach to kind of supply and distribution of a lot of life-saving commodities for the past 10 to 20 years. So I would stay tuned. I think even if the organizations continue to exist, I think the power dynamics within them are going to be shifting in a substantial way in the months and years ahead. Over.
So let me push all three of you in this particular topic. So I appreciate in a way, there's this optimism. So there's a call that things must change. We are at a turning point. We are at a tipping point. We're at a crisis point, and we need to change. And there's all these list of problems. And then there is a sense of, this is all difficult. The world is there's a lot of bad things happening, right? What I'm seeing is not that. What I'm seeing is that there are some people that are absolutely flourishing, and there are some companies and institutions that are booming, and there are some people that are incredibly happy and busy and flourishing. Not excluding a handful of men who are running these international organizations. And you talked about trust and transparency. Over the last 8 months, there has been absolutely no transparency. There's been lots of conversations between a few group of people over billions of dollars and how we're going to solve this problem, etc. So it's not that the world order needs to change. I think that it's actually going to get even worse than what we have been saying it is, right? So we were asking for more democracy, more multilateralism, more transparency, more involvement. And actually what's happened over the last 7 months is the problem is too complicated. We'll just take care of it amongst these few people. And I think that just has sort of exacerbated everything that was wrong. So tell me I'm wrong here. Tell me I'm wrong, and you've got a different view on these things. Anyone who wants to?
I cannot tell you you're wrong. I would I share the worries, Sridhar, that you already have mentioned, and I want to go back to the important point that it was mentioned as well by Oren, that the many stakeholders, many countries have lost trust in the current system, and to regain trust it would be really very difficult to regain trust. You need to actually, in this new global order, and the role of the institution, including UN institution, by the way, requires a lot of efforts, requires a different way of working, requiring a different set of values of emphasizing what this is all about. So my worry, I share some of your worries, to be honest with you. I'm not seeing till now a real effort. I'm seeing a lot of commitments, words, political rhetoric, a lot of conferences and scenes. But I mean, look at some of the global meetings that happened a few days ago. There hasn't been really a serious I would say, groundbreaking commitment that we say, well, we're actually moving to a new order, or we're revisiting how we are doing things. So I do worry in a crisis like this. Yes, there are people and countries that will suffer, and there are also people and sectors and private industry that will flourish and will benefit. And this will also create another set of inequities, more than what we already currently have. So that's why we need an institution. Look, if we look at the Second World War, where after that we had a lot of challenges, global challenges, and after that the UN system came to play to address many of those challenges. But between the Second World War till now, there has been also a new set of challenges. The question is, we need also some of those global institutions to revisit how things are being done, how they can actually address the new emerging challenges. Certainly, there has been a lot of dysfunctions that we have seen it as a result of the pandemic. That's why I'm saying it could be an opportunity, or it could be a missed opportunity if we don't hold them into account. The abuse and misuse of power across different levels, from the global to regional to national, is problematic. And we need to better engage with this power structure. We need to better understand that power structure and the asymmetry in terms of power. And we need to hold them accountable. We need to speak the truth to power, but we need to act. The question is really, who would be acting? Who would be actually the entity, the institution that will actually try to address some of the concerns that Sridhar, you've already mentioned, which I already shared.
Good. Anyone else?
I could jump in. Yeah, I think you're right there, Sridhar, and we're at a historic moment, and I think I would agree with the previous comments. We're at this kind of point of difficult choices. So you're right that even in this most global of events, when basic public health principles tells us that health is intertwined with the health of others, and basic human decency tells us clearly what's the right thing to do, we see self-interest and we see nationalism prevailing in some circles. Might need to face the fact we never change the minds of many people out there, that their normative framework is so firmly based in individualism and competition and self-interest. We will never move those people. But I often think, when someone suffers a major health scare, like a heart attack, this leads them to make major changes in the way they live their lives. And they stop smoking, they change their diet, they start exercising, whatever. So this pandemic is quite literally a collective health scare for us. It's not even a scare, it's an actual event. So we've all been shaken. Our lives have been turned upside down, some more than others, yes, of course, but nobody's left unscathed by this pandemic. So we have a real valuable opportunity to make some major changes to how we collectively live our lives. It's like a second chance to us. So I agree that coming out of this pandemic, the foundations of world order are shaky. Whether there'll be change, we will have to see, but they're at the shakiest that they've been, I think, I would agree, since the Second World War. And out of the wreckage of world conflict during the Second World War, we had the UN system emerge. And of course, WHO was included in that in 1948. And so as we move forward from this global emergency, the one big difference is that we have faced a common enemy. We haven't fought with each other, we've fought this virus. that is a big difference for me. And in this sense, I think there is hope of rebuilding, reforming, creating institutions. It won't be perfect, and it won't be, probably what I'm imagining. It's going to take time, but I think we will not go back to exactly the way we have been operating previously. So I live in hope. I may be wrong, and I may, become a cynical older scholar as I retire. But this is what gets me up in the morning. I still believe that I think we're going to come to our senses and create some of the institutions that I think are long overdue.
Thanks. Dr. Levine, did you want to add anything? You don't have to, but do you want to?
No, only to build on a little bit of what Kelly was saying, and just I wasn't going to try to dissuade you of your provocative initial point, but rather to ask whether the judgment is really around what do we do next. Like, I think there's a very clear realization now that we were not prepared to handle this pandemic, neither nationally in many places nor globally were we ready. And as Kelly said, like, maybe this was the heart attack moment, and what happened in the heart attack moment was you didn't have a democratic moment. You had to call in the crash cart, get the patient saved, and now the question is, how do we collectively figure out what's a healthier diet, what's a better exercise regimen for us, and can we go forward? So I think it could be both true that we had a moment right now that that exacerbated some of the inequities in power, and we may also have a moment to have that conversation and ask ourselves, going forward, what do we want to do to change our behavior and patterns so that we don't end up in this situation again going forward. Over.
Brilliant. So that really nicely bridges where I want to take this conversation next about, so what's the, like you said, like, this is that moment in which we say, I'm going to change my life. I'm going to change everything. I'm going to do, better tomorrow if you just give me the second chance kind of moment. So the commission, this Lancet University of Oslo Commission, identified a number of issues that Fadi had already identified in his opening talk. So they talked about austerity, war, migration, intellectual property, trade regimes, big tech, all of these different kinds of threats to people's health in the world. So all of these can have good impact on health, but they also can have negative impact on health. And there is a great amount of work that needs to be done in order to do that. But, one thing that I would say is that this pandemic has shown us that countries and people in countries need to have some basic social protections in order to be resilient against individual and communal health threats. That seems to be a fairly the hallelujah, what do you call it, moment, that sort of, oh my God, this is what I need to do next. But how likely is it, for example, the Gates Foundation, if I understand it correctly, has shut down all other programs and said, we are only going to do COVID because nothing else is going to happen. Or this was what I got from the people on the ground in different countries, basically saying, not everything's going to be dependent on this getting solved first, so we have to do it. But lots of countries shut down all healthcare. Even developing countries that have got other epidemics going on shut down their programs in order to deal with COVID. But it's not just that healthcare has to keep going in order to deal with this epidemic. The big lesson seems to be that we should be focusing on basic, what we would call social protection programs or welfare programs or minimal threshold quality of life programs. That is what actually impacts vulnerability to disease and resilience against threats. So first, what do you think of that as the way forward? And what's the possibility and plausible way forward for that kind of move. Who wants to go? Anyone, whoever wants to go first can. And please disagree with me. I mean, I don't mind.
I can go first. I think, yeah, I think while we have the attention of the world with this pandemic, particularly of funders, donors, I think I would frame the importance of investing in social protection programs in terms of building deeper and more sustainable resilience in society. So there's now all this talk growing with the COVID-19 vaccines on the horizons of building back better. And you hear this phrase a lot, you know, increasing resilience through future pandemic preparedness. So all these terms are being thrown about. And a lot of this talk is focused on really core capacities under the international health regulations, you know, to ensure that all states parties meet their obligations under the treaty, and things like early warning systems or surveillance, reporting. And then other discussions are about stockpiling for future pandemics, you know, PPE and ventilators and contingency funds and so on. So it's like one mass preppers convention. And we're thinking about, you know, preparing for this next pandemic around the corner. And I'm not disregarding that. We will have future pandemics. I have no doubt about that. So this is, you know, maybe even a warm up to that. But what we must not forget is that preparedness is not just about reacting. It's not just about, you know, waiting for the event to happen and then everybody sort of like scrambles around. And obviously we haven't done that very well. This is important because none of us were actually ready with that approach anyway. It would be much wiser and really to give far more attention to prevention. And so if we can stop an event from happening or reducing the risk of it happening or reducing the severity of the event, then this is a far better investment. So this is where I would bring in the social protection programs that we're talking about. And healthier populations, healthier environments means reduced risk of another major pandemic. We change the way societies function. We create, you know, safety nets so that people don't fall through and then pandemics get worse. And then we change the trajectory of future events. We change all sorts of things. And of course, this is not going to be cheap. This is going to cost resources, but it'll be far cheaper than the spending we've seen during this pandemic. The money that's being thrown around is eye-watering, really. So it's about investing in the social protections in order to be more resilient. It's embedding resilience within our societies through social protection programs, and that would be money well spent.
Can I build perhaps on this?
I'm just going to point directly to Dr. Levine. So is Bill Gates going to talk about social protection programs, or the head of the Gates, you know, development programs? Are they going to suddenly recognize this moment as this is not about disease-specific interventions, but we actually need to be talking about, you know, making sure that everybody has some basic social protections? Who are the leaders? Who are the voices that need to carry this message for it to happen?
So great questions. And I think it would be a false debate to say that you want to only focus on one or the other. I think for sure, one thing that is undeniable, only a few percent at most of the global population has experienced COVID as an infection. 100% of the population has experienced the social and economic consequences of COVID. That's an undeniable fact. And so it's obvious that social protection, economic protection, those need to be important features of both the preparedness and the response for any of these. I also think that there's been health consequences, legitimate health consequences, and that there's more that we can do to help be better prepared the next time one of these pandemics comes, to be able to tackle the health consequences and the social and economic ones. I think on the social and economic side, I think there are a number of different actors that play important roles in those responses. National policy is by far the most important, right, on a day-to-day basis. And different countries have different, if you will, social contracts, different ways of making those decisions about how to kind of build the resilience and protection and safety net that exists in the different countries. There's also a multilateral financial system that has a really important role to play in the moments of shock, if you will, that come into play. And I'm just a simple epidemiologist. I'm not a macroeconomist or an expert in that area, but I would assume that those organizations would have a really, really important point to play, or a really important position to play in making key points to national governments about the importance of having safety nets for the social and economic resilience that we've found lacking in the response to this particular pandemic. Over.
Thank you. Fadi, do you want to respond?
I just wanted maybe to reinforce perhaps discussion about the social protection. I think I would certainly argue that we will have always a health injustice, and this will continue as long as we really don't address the issue about the root cause of the health inequity. Now, when we talk about we've seen that many of the decisions that really affect health is really outside the health sector. And I think the question really how we can really more engage with the sectors and actors, and how we can influence the policy process, the decision-making process outside health, and how we can make sure that those decisions have a positive impact on health outcomes. This is really major. I mean, one of the things we've seen from the pandemic, that first of all, many people really didn't understand what public health is all about. And I think it took a pandemic for the world to understand what public health. But what is really clear now that the route or the roadmap for economic recovery is public health. Now the question is, this is good, but the question really how we can really engage with the existing power structure, how we can ensure that we can influence political choices, so to invest on issues related to social protection, prevention, etc. So these are, I think, what I'm trying to focus on. I think we all agree on what needs to be done. The question for me is the how we can actually make sure that this could happen at the global level, regional level, at the national level. That's the challenge that we have ahead of
us. Excellent. I mean, I think that's right. And so, let me try to, before we move out to questions, because lots of people are asking questions and discussion, I want to bring it back to the initial points that you all made, and particularly, I want to talk about so one of the things that I found very interesting in the initial months of this year is that really famous macroeconomists like Danny Roderick, who's well known for this concept of hyper-globalization and financialization, and sort of basically arguing that we've gone too far in this idea of free markets, and we've connected so much that we're actually, and what was so astounding to me is that he actually clearly stated, I did not know there was this thing called public health. I knew that there was this thing called healthcare, that if your economy is doing well, then you can pay for more of it. But I didn't know there was this thing called public health. So now we're in a very interesting situation where even the most sort of well-known and powerful intellectuals and policymakers know, and I don't know if you saw this, right? So Henry Kissinger suddenly talks about global health. Gorbachev suddenly is talking about global health and how he's going to commit to making sure this is going on the former Bank of England is talking about new values of solidarity, et cetera, right? But what's going to happen is that everybody's going to say, and Professor Lee was sort of talking about how everything's become all about the market and financial, but every time you actually point to them and say something, they'll say, no, you don't understand. We need that in order to improve the lives of our people, right? So growth is, supposed to be synonymous with the improvement of the quality of life. So whatever we say here is always going to turn back to none of this is going to happen if we don't get resources, and we don't get resources unless we let this market thing go on. So I guess my question to you is, how do we, at a global level, not at a national level, who are the people that are going to be able to, as we say, talk about the relationship between health and the economy, and how do you, and how do we recalibrate what is actually coming first and what is the instrument? Is it economy that's the instrument towards health, or is it the health that's the instrument towards the economic growth, which will then improve our well-being? Do you have any view? I mean, you don't have to. I'm just sort of would be interested to see who you think the actors are in the world that should be taking up that conversation.
I'll jump in quickly, and I think we just need to distinguish between what is the ends and what is the means. And I think we've got it flipped around in the world. Wealth should be the means to the end, which is better health and wellness, or just social justice, or whatever the end that lifts us all out of, to allow us to achieve our full potential. And so the problem is that wealth has become the end in itself, and that has driven everything. So this idea that somehow we must keep the market unleashed, we should allow it to run its course, it'll generate the wealth, and all the ships will rise in the harbor, right? We've heard this before, the trickle down, all of this arguments for decades. It hasn't happened. And so we have to remember that we put at the end human welfare, or whatever we describe this as, and equity. And so that is where we're heading. Where we get to, I'm not being naive and thinking we need to, nationalize everything. Of course we need markets, but we need to regulate markets in ways and let it serve us, not us serving markets. And I think that is why I think this argument needs to be flipped around. So that would be my quick response, Sridhar.
This is, just the one, maybe one point, Sridhar. I think this is quite an interesting question, and I don't claim that I have the answer for that, but I think it should make us really think about, who are really the actors. And but before we actually talk about the actors, I think it's very important to really think about how we can have a more interlinked, I would say, policy agenda that can filter down and cascade into all the agendas of all those big actors, economic, public health, and others. So we need this type of interconnected policy agenda. We need to see more of a new multilateral platform to maybe convene and create a platform for this type of discussion, and making sure all the global actors, economic actors, public health, and others are really clearly and explicitly putting some targets and goals and resources in terms of strengthening public health. And I want to mention here that high-income countries has an important role to play here. And I think we all know that the inequity that we have when it comes to distribution of power, of resources, of knowledge, technology, etc., etc. And I think we need also to yes, we can put all stakeholders alike at a similar level, but certainly also I would maybe push that we need to really think about high-income countries and what will be, in fact, the renewed role that they should play in actually pushing this to ensure an interlinked agenda, but to ensure commitment, accountability, and delivery, meaning really putting not only at the level of strategic plans and agendas, making it happen. And that's what we need to actually think, how we can hold stakeholders, global stakeholders, accountable to whatever they commit to commit to with the health as an outcome.
Dr. Levine, did you want to say anything? I mean, if you don't have anything to say, I mean, so I guess
I think we should go ahead and take some of the questions that are coming in the chat. I think my colleagues have covered that topic really well.
Okay, great. Sorry, I muted myself. So I think that we've got people reading the questions, and perhaps they could consolidate them. So Katerini or Aurelia, do you have any clusters of questions or a general? Yeah.
Hang on just a second. I think a lot of there's been quite an active conversation in the chat, but some of the questions that come up repeatedly have to do with the issue of participation and transparency, some of which have been touched upon already. There's been questions raised about and Usher from Development Today and the Lancet about the lack of transparency that we've seen in COVAX, for example. And Rosanna from VEMOS has also raised the issue of the most vulnerable. How are they going to be represented, have a seat at the table when we collectively change how we live? Desmond McNeil, our colleague who was a commissioner on the Lancet-University of Oslo Commission, also puts it this way. He says, in a fast-moving crisis, the issue of trust is crucial. National governments have often taken decisions with very little debate. Now, some months later, this is being questioned. What is the appropriate balance, and to what extent can urgency justify a lack of transparency? Also at the international level. This would be something that the panel, has already addressed to some extent, but are there comments in response to this issue about transparency, which seems to be an overriding concern in the discussion?
I mean, the only quick point I would mention that the urgency should not be an excuse to make decisions that are really not transparent and not to be held accountable. In fact, the urgency should be another reason why we need to put together and strengthen institutions at the global level to become responsive and transparent and accountable. So I don't buy into this argument that we know that at a time of crisis, the rule of the game does not apply. But when we say the rules of the game does not apply, this means that there might be abuse of power, there will be a lack of transparency, there will be also things that might not go into the right direction. So I think the question would be, what would it take to strengthen the institutional capacity and the monitoring capacity at the global level in order to actually be able to better respond to future pandemic in a much more transparent way? Now, we didn't mention today, although it was touched upon, about the role of science and the role of evidence of how decisions are being made. And I think there is a lot to be said, in fact, about how evidence was used or misused or not used in the response and what were the implications for that. There's an interesting actually case to be made also about how science was used or not during the pandemic. So my quick answer that this should not be a justification at all to be not transparent.
And I would just jump in and agree with that. I think during public health emergencies or any emergency, the first thing that goes out, I suppose, is, democracy and human rights, as if, we suspend these things. And we've seen that trust is a huge issue during this pandemic, public trust. So if we lose public trust, we can't do anything. People need to believe in that there's good governance, that the governments are working in their interests, that public health officials are, making decisions based on evidence and not on self-interest. But a lot of this is swirling around, and we're seeing a real disaster in terms of public trust. And this is part of what's making the virus so difficult to fight. So we build in good governance into this idea of preparedness, that we've been so unprepared in so many fronts, but in terms of building some process of governance where there is transparency and accountability before an emergency happens. We need to think all this through before an emergency happens, because we're now making it up as we're going along, and it's very hit and miss, really. So we don't know what, for example, these vaccines, where's the patient level data? That's not being released because it's supposed to be some commercial reasons, but how can people trust the vaccine if they don't see the patient level data in terms of any adverse impacts? So, it is in the interests of people who are in power to be transparent if they want the rest of us to follow along. And, it's a really basic thing, and I hope that comes through.
So I'd like to ask Dr. Levine, and I apologize. I'm sure that you get put in this position a lot, which is you represent the foundation, and so a lot of people have lots of questions about the foundation. So in a very interesting way, you're the one who raised the question about trust, and I would have thought that you'd be the last person to be raising the question about trust. So in 1 week, Mr. and Mrs. Gates have had phone calls with the president of France or the president of Germany and, the president of the EU. What are they talking about? I mean, what is it that, the question about trust is a big problem in general about me and my leader. But then here's this other people that are doing stuff. So what is it that the foundation is doing to build trust in what it's doing and these individuals are doing? In a way, they are whose interests are they promoting and what are they doing? And so, explain to us how trust works in your world and how you're building trust in the global health world, and for the average person who's reading about how important they are in this sort of world that we are currently living in.
Yeah, thanks. So I think trust is the bedrock of public health. I mean, it's not just public health, but health, medicine, many other disciplines, and it's been under attack. There's a lack of trust in institutions. There's a lack of trust in science, and it needs to be restored. I think transparency is one way of kind of building trust, right? But in some ways, this is me speaking. This is not the Gates Foundation speaking. But in some ways, it also feels a little bit like the absence of trust, right? And I'm not anti-transparency. Don't misrepresent me. But this notion, like when I'm in a trusting relationship, what I trust is that some other person is working with interests that are aligned with me for reasons that I understand, and I don't actually have to hear them vocalize every step of that. We have trust between us. It feels in some ways like transparency is both a way to build trust, because when I can see transparently your actions, that builds my confidence that you're acting in a certain way, but also the opposite of it, which is in the absence of it, I don't trust you at all, which is not consistent with the way that my wife and I have been married for 21 years. I trust her quite a lot. I don't know exactly what's going on in her head all the time, but I trust that we're aligned and working together. I think in terms of the foundation, you're right. Our co-chairs, Bill and Melinda, are advocates for lots of issues in global health and development, gender equality, better health, stronger primary health care, all those kinds of things. And so when they have an opportunity to interact with someone who is in a position of power, those are the issues that they're talking about. You can bet that if Melinda Gates has an opportunity to talk to a world leader, she's going to talk about gender equality. She's going to talk about putting women at the center of the discussions about how decisions are made and lifting them into that dialogue. So I think you should expect that the kinds of issues that they've talked about publicly are going to be exactly the kinds of conversations that they have when they have an opportunity to talk to somebody.
Can I come in with some more questions from the audience? So a common thread in the questions that are being posed have to do with this issue of transformation, but also questions around how transformative the panel sees the future world order being. Are we aiming for a post-capitalist order, including radical redistribution, recovery, and repair of historical inequities under globalization, or more of the same? That was from Renko van de Pas. Anand Bhopal says, isn't it, taking this heart attack moment metaphor, isn't a potential problem with this heart attack moment thinking that health, at least when we measure it in life expectancy, has been improving almost everywhere. So on the basis of this dominant health metric, we're progressing. So the pandemic is a blip and will soon return to normal. But the heart attack mustn't lead to just a change of diet, but a shift in the food system, not to an increase in exercise, but transforming how we travel. So it's a radical shift in how we think about the causes and effects in health. So these are the sorts of comments that are coming up in the chat. And I just want to end that stream with a comment from Christophe de Koster, who, as always, is cynically asking, do you think that the vaccines now are coming, in a cynical way, he says, too early, so that the global order can just move on pretty much the way it was in its very inequitable and unsustainable way? Have we missed the boat, in effect? Thanks. You're all invited to comment.
Yeah, I mean, I think if I could just, while you're thinking about it, I guess the questions are all basically saying, you know, what's the transformation agenda here? And who's going to be pushing that agenda? And, you know, there is a real possibility that vaccines are essentially how we go back to where we were, right? You just sort of don't change the environment, you just inject the person, and then you just keep everything the same. Or this transformative of transforming the society, the social conditions and infrastructure to ensure that we prevent future threats. So we've got to, and if you ask somebody, you know, and if you say this out loud, people will say, you're so dumb, you're against vaccines, right? It's like, I'm not against vaccines, I'm just telling you that this is what the stuff. So how would you, and so that's the question I think that people are asking, is that, are we just trying, what's the transformative agenda here?
Yeah, can I respond to that, since we started with the vaccine piece and people are asking, you know, do you understand why people distrust and all those kinds of things? Yes, it does make me sad to hear you, though, basically propose that giving people around the globe immunity to a virus that the entire planet lacks immunity to is effectively the wrong thing to do. It strikes me as a little bit the version of the sort of let herd immunity play out, just let it cull, so that, like, I think we can both protect my 80-year-old mom against a virus that she doesn't have immunity to, and have a dialogue around transforming systems. I don't think that those two need to be in juxtaposition with one another. And I think for all of the problems that we have, I'm probably going to continue to see the fact that we went in 1 year's time from never having heard of a virus to successfully developing one that protects people at 90% or greater effectiveness as a pretty amazing accomplishment. One that I wish the world had undertaken in the mid to late 80s for a different virus, right? And it doesn't change the fundamental structure of the global economy and all those kinds of things. But there are a whole lot of people who will suffer from a otherwise preventable illness in the interim. And I think we shouldn't put those two at odds with each other. We should both capture and make sure that we equitably allocate it, roll it out equally, right? I want to see the vaccine roll out in Namibia, Nairobi, New York, and New Delhi all at the same time, right? That's what we want to do. And I don't want that to then say, oh, because the immunity is here, we don't have any other problems in the world and we can just go back to normal. But I fear that people will use it as a wedge that will have a lot of consequences for a lot of people at the same time. So just wanted to acknowledge that.
Can I perhaps just a point to build on that? And I think one of the, so I like what definitely Oren mentioned about the equity in terms of distribution of vaccine, regardless of the timing. But again, and I mentioned this earlier, and I think we should not accept the idea and the assumption that we will have some delay where richer countries will actually have easier access to vaccine. We should not accept this at all. And I think this is very critical. And we're still actually hearing about vaccine nationalism, even within some of the high income countries, which is really quite, so talking about transformation, I think what is really critical is really to see, there's a Lancet transformation agenda, but just to put it really more broadly, we need to see transformation in the type of decisions that are being made and in the way and the processes of achieving those decisions. And I think this is extremely important. Part of it is really about the interlinked policy agendas and to mention among this. But I want to mention, I think one thing maybe we didn't really discuss so far. We've talked about economic power, we talk about military power, we talk about, but I think we need also to think about and talk about normative power. And what that means is the ability to shape beliefs of what is acceptable, what is socially acceptable, what is appropriate, what is ethical. And I think the international non-governmental organization, NGOs, the media, and other civil society groups play a very important role to have an impact. So the question is really how we can harness their potential, how we can actually also see a transformation in how they are impacting global health, how they are prompting, inspiring, shaping political mobilization. These are important things, in addition to having an educated and well-informed citizens. This is also something that I see certainly a great opportunity given the pandemic. More and more lay people now understand what health is all about. They want to be engaged. They want to see that they are not happy with how their government is dealing with it. They want to make sure that they hold them accountable later on at the election time, etc. So I think the normative power part needs to be also unpacked and maybe harnessed in order to see more impact in shaping global public health.
I think we're almost out of time, but I'll just very quickly have a couple of things. One is on this transformation agenda, I don't have a detailed plan, but I do know that there's not just one form of capitalism. And I think, this post-capitalism idea, it's not getting beyond capitalism, it's finding a new form that really serves us rather than us serving it. So this laissez-faire, market-driven, unregulated capitalism is just, it hasn't worked. It hasn't worked for most of us. And secondly, how do we get there? Like the Second World War, we had a major conference that brought countries together, which brought people together. And I think maybe that is what we need, and we need to draw on, this idea of a social contract. I know somebody has mentioned this, a global social contract. We need to hammer that out, and what that contains. We have to have a very clear sense of how we exist in this world alongside other animals, the environment, on a planetary, from a planetary perspective. And I know Samuel on the chat was talking about, the link between the pandemic and the way we have lived with the environment. We have harmed the environment, zoonotic diseases have emerged from that, and so on. So have no time to go into that, but for definitely, we have created these risks by the way we have structured our world as I started this conversation. And I think that a conference that would move us forward is really necessary, like after the Second World War. I think we're at that defining moment in history.
Yeah, no, thank you very much. And I think that, this is, I really wish that we had started at this point, and then we would then struggle through, like, what do we do now that we understand what the lay of the land is. I was really hoping that we'd solve all the problems today, but it's really wonderful to actually talk about this. And as there's very few places that we can actually have a conversation about politics at a global level and their impact, and actually have people who are very directly involved in all of this. And so it's a really important sort of conversation. So I think that we are getting out of time. Katerini, are you ready, or do you have anything? Yeah. So with that, I just want to sort of quickly sort of say two things. One is that Dr. Levine, if you ever see a map for your agenda where you said, you know, how you can do both a vaccine for everybody and a transformative agenda, and you see something where that is both laid out, I would love to see it and share it with us. I think that's exactly the thing that we should be focusing on, is that what do we do with these two things and how do we bring them together? But aside from that, I want to thank each of you for making the time today and for tolerating my questions, and also for really enlightening us in all of this. And I look forward to hearing more from you in the future. So over to you, Katerini.
Okay, thanks, Sridhar. On behalf of the independent panel on global governance for health, I really want to thank Professors Lee, Levine, and El-Jadali, and you too, Sridhar, for a really fascinating discussion. We only started the conversation, and it's clear from all the comments in the panel that this is a topic that people want to continue discussing. The session, of course, wasn't supposed to be about COVID, but it's clear that the pandemic really provides a window that highlights all of these global governance challenges that the Commission has been concerned with, and how to improve health equity between and within countries. And I think there were a lot of sort of golden nuggets from the speakers here, but some of the ones that I noted down, you know, this thing that Fadi said, there's no health security without social security, was an important takeaway for me, and also this urgent need to correct imbalances in the current world order, which we've spoken about. So I think all of this is very much in keeping with the Lancet-University of Oslo Commission's emphasis on this idea that the root causes of health inequity aren't only in the health sector, but are also in all these other sectors that we've spoken about, and they're not always in national control, but are really transnational and often global in nature. And so I think, just to end, it's clear that as all the speakers have mentioned, we're now in a moment of crisis, but one of the resounding themes was that this presents an opportunity for going forward, and one in which trust will be a central force really to chart the course for health equity. And so I just want to thank all of the speakers again, and also all of the participants for listening in for this over 90 minutes of discussion here. As I mentioned at the start, the session has been recorded. It'll be available both on the portal of the Global Symposium on Health Systems Research conference website, and also on the website of the Independent Panel on Global Governance for Health at the University of Oslo. Thank you very much, and good night from Oslo, and have a good day on the other coast. Bye-bye.
Thank you, everyone. Thank you.
Thank you all. Stay safe. Bye.